What I wanted to talk about today is why it's so important to take the time to consider what specialty is right for you when you are a new graduate. And why it's so important is because this job that you're going to choose fresh out of nursing school is going to provide the foundation for your practice. You're going to get the training that you need. You're going to get a lot of extra support from your employer, hopefully, because this is the first time you're transitioning from being a student into becoming a real life nurse and providing care for actual patients rather than just shadowing somebody and kind of just like helping on the side. And my biggest pieces of advice are one, go with your gut. If something feels right and it feels like a good fit, that's usually something that you should run with. If something feels like it's a little bit off, or if you're not quite sure, don't forget that and make sure that you still listen to that as well. Two, you want to seek out opportunities where you are shadowing nurses that are doing something that you're interested in. Ask them questions. Ask them not only about the good things, but the bad things as well. And if you can do your senior preceptorship or your senior capstone in the unit that you're most interested in, that is the most important thing that you can do, because when you're applying for jobs at a school, employers are going to be looking to see that you have experience in that area already. And if you've done your capstone in that area, that's going to give you a leg up on the competition. So other things to ask yourself are whether you want to work in a hospital setting or if you want to work in more of an outpatient setting. And if you're working in the hospital, is there a specific unit that you are drawn to? Is it floor nursing where, it's med surge or hem-onc or surgical? Are you interested in the emergency department or maybe even critical care? Those are all things to consider. And then also, if you're considering outpatient, what type of outpatient setting do you want to work in? Do you want to work in a school? Do you want to work in a urgent care clinic, etc.? And another thing to ask yourself, do you want to work with adults or do you want to work with children? Some people have a very strong preference for working with one or the other. And also think about, okay, well, what am I like innately kind of drawn to? Do I really like working with babies? Do I really like working with older adults? And then seeking out those opportunities, like I mentioned before, to shadow nurses that are doing that exact thing. So hopefully these tips are helpful in figuring out and helping you figure out what you want to do with your first job. And I'm so excited for you guys, especially if you just graduated. Welcome to the world of nursing. As always, leave your questions in the comments below.